So there are many, for sure. Practical considerations are first, clinicians need to be aware of the techniques to improve the accuracy and the performance of ChatGPT. Normal zero-shot prompting, which is when we ask just a simple question, has a lower accuracy and lower performance than more advanced prompting, and so this is important for people to know how to ask a question to GPT or to any other language model. This is very important. Second, is very important that clinicians should be aware that models can hallucinate, they can make mistakes, they do, and so they should be aware that they need to be critical, they still need to rely on their clinical knowledge to interpret the results and envision it in the clinical context of the patient, which is something only the human clinician can do at the moment. I think another very important limitation is ethical, of course, because the patient come to us as doctors, and we need to provide our expertise. We should not see GPT as a substitution of ourselves or our clinical reasoning, just as an aid, as I said before. And also, as the future approaches, I think one main important point is these technologies should not lead to, for example, a reduction in the doctor to patient relationship just because we have another tool that can substitute us. The main point is to use it as an aid so that our relationship with the patient, our core clinical reasoning remains at the center of the clinical work, but is enhanced by some model, which of course we know we have knowledge limitation in the real life, and these models may help in to bridge this gap. Of course, there is also, privacy relevant limitations, because of course we are supplying this information to models which need to be standardized and approved for that, which is something we currently don't have. And of course, we also need to find which is the best model, which is the best prompt, which is something we currently don't have, to be sure that that we have the best possible solution. So at the moment, it's something very exploratory. The clinician may rely on in their clinical practice if they really need help for complex cases, but it's not something we can use for everyday clinical practice for every case. It is not the way we are right now, I think, at least for these complex cases of polyneuropathies.